Imagine carrying a healthy baby, only for your own immune system to mistakenly attack your baby's red blood cells. This life-threatening condition is called erythroblastosis fetalis, also known as hemolytic disease of the fetus and newborn. It can cause severe anemia, brain damage, heart failure, and even death if left untreated. The good news is that modern medicine can prevent most cases. In this video, you'll discover exactly how this disease develops, why it happens, and how doctors save the lives of thousands of babies every year. What is erythroblastosis fetalis? Before we understand the disease, we first need to understand the job of red blood cells. Red blood cells transport oxygen from the lungs to every organ and tissue in the body. Oxygen is essential for growth, brain development, and keeping every cell alive. Inside the womb, the baby depends entirely on healthy red blood cells to receive enough oxygen. In erythroblastosis fetalis, the mother's immune system mistakenly creates antibodies that attack and destroy the baby's red blood cells. As more cells are destroyed, the baby's oxygen supply decreases. The baby's heart has to pump faster and harder to deliver enough oxygen throughout the body. Without treatment, this constant destruction can become life-threatening. Understanding the Rh blood group. The most common cause of erythroblastosis fetalis involves something called the Rh factor. People are either Rh positive or Rh negative. Rh positive blood contains a protein called the Rh antigen on the surface of red blood cells. Rh negative blood does not have this protein. Problems can occur when an Rh negative mother becomes pregnant with an Rh positive baby who inherited the Rh factor from the father. During the first pregnancy, the mother's immune system usually has not yet learned to recognize these cells as foreign, so the baby is often unaffected. However, after exposure to Rh positive blood, the mother's immune system remembers it and prepares antibodies that can affect future Rh positive pregnancies. How the disease develop. So how does the mother's immune system become exposed to the baby's blood? A small amount of fetal blood can enter the mother's bloodstream during childbirth, miscarriage, abdominal injury, bleeding during pregnancy, or certain medical procedures. When this happens, the mother's white blood cells identify the Rh positive cells as foreign invaders. Her immune system responds by producing specialized Y-shaped proteins called antibodies. These antibodies remain in the mother's body for years. During another pregnancy with an Rh positive baby, the antibodies cross the placenta and begin attacking the baby's red blood cells. Damage to the baby. As the antibodies destroy more and more red blood cells, the baby develops severe anemia. To compensate, the baby's bone marrow works much harder to produce new blood cells. The liver and spleen also enlarge because they begin making additional red blood cells. Meanwhile, destroyed red blood cells release bilirubin, a yellow pigment produced during the breakdown of hemoglobin. After birth, if bilirubin rises to dangerously high levels, it can enter the brain and permanently damage nerve cells. This serious complication is known as kernicterus and can lead to hearing loss, movement disorders, intellectual disability, or death. Severe complications. If the anemia becomes extremely severe, the baby's heart struggles to pump enough oxygen throughout the body. Eventually, the heart begins to fail. Fluid starts collecting beneath the skin, around the lungs, inside the abdomen, and around the heart. Doctors call this dangerous condition hydrops fetalis. Without urgent treatment, hydrops fetalis can become fatal before birth. Diagnosis. Fortunately, doctors can often detect this condition before the baby is born. Routine prenatal blood tests determine the mother's blood type and check for Rh antibodies. Ultrasound scans monitor the baby's growth and look for signs of swelling. Doctors also perform Doppler ultrasound examinations to measure blood flow in the baby's brain. Faster blood flow often indicates severe anemia. These tests help doctors determine exactly when treatment is needed. Treatment and prevention. The most effective treatment is prevention. Rh-negative mothers receive an injection called Rh immunoglobulin, also known as RRIG, during pregnancy, and again after delivery if the baby is Rh positive. This medication prevents the mother's immune system from producing harmful antibodies. If the baby becomes severely anemic before birth, doctors may perform an intrauterine blood transfusion, carefully delivering healthy blood directly to the baby through the umbilical cord. After birth, babies may receive phototherapy to reduce bilirubin levels, or, in severe cases, an exchange blood transfusion to replace the damaged blood with healthy donor blood.